I hope that this last bit leaves you ready for more. I don't know about you all, it's been so nice to be in person and hear these talks and be around other cancer nurses. Y'all are my people, and so grateful for the work that you do all the time. And it's been just inspiring to be in a room full of other cancer nurses again in real time. So hopefully this gives you a little bit to where you leave ready for more. Oh, okay. Hang on. I don't have any disclosures. That's me. And this is me with my family. So I'm just going to start out with a little bit of my narrative, a little bit about me. So this is my husband and my daughter. This is also our new puppy, Toby, who is like lucky. He is so cute because he is a wild, wild man. I don't know if you've had a puppy recently, but he's a lunatic. So I started in cancer nursing about 15 years ago. I spent 5 years at the bedside and then another 5 as a cancer navigator and an NP for a lung cancer screening clinic. And now I have the privilege for the last 4 years or so to work as a director for a cancer navigation team for a division of hospitals with Sarah Cannon and Health One. And some of my amazing team people are here today. These aren't the most recent. Okay, so I'm gonna wing it. Okay. So oncology just kind of found me. I started out on the unit and I was so inspired by the patients, and caring for people in their most vulnerable moments was just so meaningful to me. It was the kind of meaning and moving work that I was looking for in my career. And the patients really very quickly became my why, my reason for doing cancer nursing. And fast forward a little bit, later in life, I had a daughter. And when she was about 3 years old, I was walking her. We were on a walk, and she got out of her stroller, and long story short, this will save the whole story for the glass of wine after the networking, but I went chasing a stroller down from a ravine, and everybody was okay. She wasn't in the stroller. We all were okay, but I took an injury to a shoulder, and I went for an MRI. And sure enough, incidentally, there were a couple of large lymph nodes in my left axilla. So on I go. I think generally there are two kinds of nurse patients. There are those that the littlest thing is like a catastrophe and the first phone calls to hospice and we better, get the funeral home ready. And then there are those that just really blow off anything as just totally insignificant and it's nothing. And I'm the latter. So I just kind of ignored it. And I don't know, a few months later, I went for a bilateral ultrasound. And sure enough, there were enlarged lymph nodes in both axilla. So, okay, well, I'm stressed, or I'm fighting a cold, or I'm any number of things, So a few more months go by, and I go for another ultrasound, and sure enough, they've grown in size, and it's biopsy confirmed. It's chronic leukemia. Average age of onset for chronic leukemia is 72. It's 70% more prevalent in men than in women. And here I was 45, and I was diagnosed with this older man's cancer. And I was working in cancer and living with the cancer, and it felt like maybe it was all too much. Maybe this career wasn't for me anymore. Maybe I needed to find something else so that it wasn't so overwhelming. And I mean, I don't have to tell you all, it was the incredible nurses and caregivers and physicians and navigators that sort of helped me through the process of that diagnosis. And I know very well that I'm very lucky. It's a chronic condition. It's not acute. But I also know cancer. I know it can convert to acute. I know that because I was diagnosed so young, that there's a likelihood I'll see disease progression, and all those thoughts that we help our patients go through the process of accepting, what does this mean for my family? What does this mean for my daughter? What does this mean financially? What does this mean in terms of the security of my life and my loved ones? And so somehow I had to find my way back. And I really was shared a lot of tools with a lot of the caregivers that worked with me to really help work through that. And not only did they help me find my way back kind of through the diagnosis, but really also to the field of cancer. And I was able to kind of reignite my passion, refine my purpose in this work, and reconnect with my why and have an even more meaningful why moving forward. So I think that I'd like to use this time to share some of those strategies. I think when I think about cancer nursing, I think about cancer nursing and COVID, and we'll talk a little bit more about that. I think that there are some of these tactics and strategies that really can help you move through. And these, many of these were mentioned, in talks throughout the day. So some of them won't be surprises, but with that. So fast forward, and it seemed to me that as we entered into COVID, we kind of all globally came to this place where we were asking some of those questions. Is this still for me? Is this still right? Is this still the right career? And so there were parallels that I saw with me going through my cancer diagnosis and working in cancer to what we were all experiencing, particularly as cancer nurses, in working in a field with seriously vulnerable, seriously ill patients, and then also dealing with this really serious looming medical, global, financial threat. And I think it has left a lot of us just totally exhausted. It's been stressful, to say the least. It feels like, as happy as I am to be in the room with all of you, I think Dr. Miller was making me think less securely about that with us having an uptick. And obviously we're not done with it. So, how do we as a team, as an industry, work to find our way back in times that are uncertain and financial insecurity, challenges with childcare, challenges with education, all these things, and also come with compassion and kindness for our patients and a readiness to care for them. I don't think it's an easy recipe, but I have some ideas. This is a little bit about purpose. The slide is really just to demonstrate. Sometimes we find our purpose. Sometimes the next day we don't know what it is again. It's an up and down, and if it's not in clear view today, it really doesn't much matter. It's there, you'll find it again, you'll lose it again. Okay, so this was mentioned before also I can't remember your name, but the social workers talk about gratitude. So there are full studies that show that people who actively practice gratitude show a better sign of contentment. So literally, if you are grateful more intentionally in your life with things, then you will consequently be happier. So how do we do that? Can you say thank you 10 times a day? Can you write in a gratitude journal or write down 5 things each day? And can they be different? I think to our point from earlier, it's real easy to say family and my health or whatever, those key 5 things. Can you change those things up? Can you think of small, little, subtle things in your life that you're happy for? Another technique is a gratitude jar. So you could write down on a piece of paper something that you're grateful for and throw it in a jar and see it accumulate over time. And that's kind of a powerful visual for all the blessings that you have in your life. And then finally, practicing meditation in gratitude. And so with that, I'm going to guide you in an exercise, and I'm going to ask you all to close your eyes, please, and take 5 deep breaths at your own pace. Doing that boxed breathing. I want you to picture a person who is most important to you, that you are most grateful for. Someone who has made the biggest impact in your life. Imagine their face. Imagine their smile. Take a moment to think hard about that person. Now send them a silent thank you. Now think about a healthcare worker. Perhaps someone who cared for you. Perhaps someone you work with. Someone who did something for you that really made a change. Did something positive that affected you. Someone who did something in their work or their way that really affected how you think and what you've become. Think of their face. Think of their smile. Smile at them. Send them a silent thank you. Now I want you to think of a third person, somebody you've lost. Perhaps someone you've fallen out in a relationship over time, someone who's passed on, a patient. Think of how they impacted your life. Think of how grateful you are that you knew them. Think of the positive impact they made on your life. Think of their smiling face. And send them a silent thank you. Next, think of yourself at 10 years old. Think of what you were like. Think of your whole life ahead of you. Think of how happy you were. Think of how few responsibilities you had. Think of your smiling face. Be happy for that person who has become the person that sits here today. Send that person, yourself, a silent thank you. And with that, you can open your eyes. So I don't know about you, but that makes me feel really grounded, really at peace, and really intentional with kindness and gratitude. And so I recommend you do something like this every morning when you're lying in bed before you get up. Think of those people. Send them a thank you. Next is about compassion. So I think we are caregivers. It's the heart of who we are to be compassionate. It's probably a lot of the reason why many of us chose nursing as a profession, and it comes very naturally, but it does reach an exhaustion point. And so how do we find and come back to a place of compassion for each other, for our patients, for others? There's been a lot of conversation, so many good nuggets today throughout the day. And one of the things that sort of crossed my mind was around in the workplace violence session and around some of the mental health pieces is that, our patients are dealing with a serious medical diagnosis and appropriately have an emotional reaction. So they're often depressed, they're often irritable, they're often angry, their families are angry. It's not something that anyone wants to accept or process. And so, we do face that, not in an abusive way at times, but we are the brunt of that. And to find kindness and compassion in those situations I think is really challenging. How do we care for those? How do we show that compassion for even difficult people, even maybe some of the people we work with, even some of the tough personalities that I know we all have in our lives? And so how do we really intentionally find kindness for those people and compassion? I would say one of the main ways that's benefited me in terms of getting on a level with a challenging situation with a person is around assuming positive intent, assuming good intent. So really imagining that no matter what anger or what animosity is kind of coming from that person, that's truly coming from a place of frustration around their diagnosis, frustration around the lack of staffing on the unit, frustration around, it truly is from a good place where that person wants the best for our patients, for ourselves. And that's really kind of changed my mindset. One of the things that I also started practicing is approaching with non-improvement. So I don't know about you, but I get home from work at the end of the day, and my husband's there, and he's scrolling through Facebook, and my daughter is there, and she's like on her iPad, I know, not watching anything educational or doing anything that's going to improve her wellness. And like instinctively, I'm like ready to pounce, about why is the homework not getting done? Where is dinner? What is, I could go on and on. And instead of doing that, like intentionally going in the door and dedicating like 2 minutes, I'd say 5, but my goal is always for 2, to just walk in the door with joy and happiness to see your loved one or your dog or your bed, or just total joy, not looking for improvement or what needs to be done right away, but just really embracing that present moment. And appreciating the positives. So how can we, and so acknowledging those flaws and not trying to fix them, and then appreciating the positives, walking in the door and thinking about, instead of going right to what's not happening, what is happening? God, this is a beautiful house we live in. I love that candle, whatever it is. So this is one way you can also do it. You could dedicate a day for a topic like gratitude, or Tuesday is compassion, and then really focus on that intention for that day throughout the day. And you can add cues for yourself too. So when you're eating meals, you're going to focus. You're going to refocus on that topic, on forgiveness, and that's kind of a way to keep it happening, keep attention to it. And then most importantly is the taking care of ourselves. And I feel like as nurses, maybe as women mostly, I know there are a couple of men in here, but it is really organic for us to put others before ourselves, to really, we're caregivers. That's who we are. And so how do we really focus on our own wellness so that we're able, the classic situation with the airplane with the mask, you're meant to put it on first. That's why they tell you, so that you're ready to put it on your child or someone else who needs help. So how do we do that? I mean, there's no secret sauce. You all know this: exercise, nutrition, meditation. Another thing that was that I was thinking about today too was this idea around sort of ruminating thoughts or worry or anxiety, and that, yes, our patients have that, but like I experience that all the time. I experience that related to my diagnosis, but I also, I experience that around work. I experience that around my family, you know. And there are true studies that show that if you can use your senses, so go outside, spending time outside is also known to improve wellness, but if you can use your senses, I see that color on that tree, and that's grounding me in this present moment. I smell this scent. I feel the cool breeze. Really using your senses. I hear the birds. To truly ground yourself in the present moment is a way to sort of stop those ruminating thoughts, to distract yourself from them and calm yourself down. So I don't think there's anything, that you probably don't know here, right? Writing, using art therapy, letting things go. I swear this is something that has been on my motivation board for the last 5 years or something. Something I work on all the time. If I'm worrying about something, does it make the actual thing any less painful or any less burdensome or any less traumatic? All that worry does not really serve a purpose. And most of the time, it's gonna have the same kind of outcome, whatever situation that I'm worrying about, whether I worry or not. So how can I just really intentionally say, worry is not gonna benefit this situation, let it go, I think that pretty much does it, everyone. I will say, gosh, we need you. We need you all so badly right now. Healthcare needs you, our patients need you, and whatever you have to do to find this space and this balance for yourself to be able to continue in this work, I support you doing, and I would imagine that your colleagues and your leaders would support you in too. We need you really badly, and we need you to be healthy for yourselves so that you can be healthy for our patients. So with that, I am so grateful to all the work you do, and I just cheer you on. I cheer you on moving forward, so thank you.